Folks, thanks for coming on the line with us today. My name's John Dubas with Premier Marketing. This morning, we're going to spend the next hour or so discussing some Medicare supplement options and other Medicare programs that can help cover some of the plan changes we're seeing in certain states. One of the things that you will have noticed on our notification about today's webinar is there are certain cost plans that are sunsetting across the country. It's predominant in 8 different states across the country, and we'll be spending a bit of time giving you some ideas that will unilaterally give you options to help address that membership. If you look at it overall, there are nearly 800,000 individuals who are on cost plans, nearly 700,000 of which will need an alternative at the first of the year. To give you a bit of an idea as to what cost plans are and what's happening with them, let's talk about some of the legislation that has brought about a change in those plans availabilities. Effective the 1st of January of 2019, law has required that all healthcare payers offering these plans discontinue those programs in service areas where there are at least 2 competing Medicare Advantage plans meeting specific enrollment thresholds. This whole process was started back in 2016 as part of different pieces of legislation that came about and part of the implementation of the MACRA legislation, which provided these cost plans a 2-year period to transition to regular Medicare Advantage programs. This legislation allowed those plans to operate until the end of this year, but only if the organization converts into a Medicare Advantage plan. So what you're going to see in certain markets is a change in availability of programs, and if a cost plan had been available in the past, it doesn't mean an alternative from that same carrier is going to be there in the future. So availability of these programs will be changing at the end of the year for folks coming into 2019. It would help to know what a Medicare cost plan is, and these are programs that are operated by a health maintenance organization, and they're technically not Medicare Advantage plans. There are some major differences between these programs and a Medicare Advantage plan. The folks that are looking for cost plans can enroll in them if they have Parts A and B or Part B only. You'll know that's the difference from a Medicare Advantage plan, because Medicare Advantage programs do require both Parts A and B in order to be eligible. These folks can receive covered Medicare services from providers outside the plan network, which is obviously different than a regular HMO type of program for a Medicare Advantage plan if it's on that chassis. And these plans, much like Medicare Advantage programs, may include drug coverage or they may not. And if they do not, unlike Medicare Advantage plans, it is not an opt-out of Part D. They can select a Part D plan independent of their health care coverage. These folks have been able to enroll into the cost plan anytime the cost plan is accepting new members, because the cost plan can shut down into the enrollment process. They're subject to different rules. And folks can leave a cost plan at any time and return to original Medicare. So they're not locked in to this type of coverage as we are in regular Medicare, with the exception of the folks that have the special election periods. So as we spoke of a little bit earlier, 700,000 individuals are going to be looking for different coverages. The vast majority of these people are in Minnesota, nearly 400,000 people. And of those 400,000 people in Minnesota, nearly 180,000 of them are in the Twin Cities region. So if these folks are eligible for a Medicare Advantage plan, if there is one in that area, sometimes there hasn't been in the past, that person may elect to enroll in the MA plan the cost plan converts into as well. So some of these carriers that are in place offering cost plans are rolling out Medicare Advantage plans at the first of the year. They have the option then to discontinue coverage, go back to traditional Medicare, and that then brings the opportunity for the Medicare Supplement programs, or enroll at that time to Medicare Advantage plans that are in that area. Keep in mind, you can't go by what plans are available now. The Medicare Advantage programs, we don't really get information on them until generally around June. So there are going to be programs available in the future that are not showing up on Medicare.gov now for 2019. So you're going to see a lot of differing options in these areas that have been traditionally just cost plan areas. It's an important point to keep in mind, and it's something that as a independent broker, it's very important for us to keep our options open as to what our alternatives are going to be in the future. Keep in mind, many of these people that are on a Medicare Advantage plan, or pardon me, a Medicare Cost Plan, may not select a Medicare Advantage plan for one reason or another. They haven't had some of the same network constraints that we've seen in the past, and we know that a Medicare Advantage plan on an HMO chassis doesn't allow for out-of-network benefits. So it gives us some opportunity for Medicare supplements specifically. A little bit of information about us to start with, so you're comfortable with some of the options that we are offering to agents across the country. We are a national organization that was founded in 1968. We're part of the Integrity Marketing Platform, a deep pockets organization that has us well funded for support and market offerings across the country. We do have offices throughout the different states of the grand United States of America, and we specialize in contracts through independent insurance agents. We do offer the contracts generally on a vested area basis with the highest possible commission levels, and if you are an agency that recruits, we have opportunities that are available for you there. Keep in mind, you can get additional information about our organization at our website at premiersmi.com. You'll also note that in today's software system, there are 5 attachments that are available for you to download out of the system right now. So some different information, including the presentation that we're going through right now, the PowerPoint presentation. That will not be a complete presentation because we're going to go into some different things live on the internet in just a moment. As I mentioned before, this is our 50th anniversary year. So we've been around for quite some time and are actually one of the largest organizations with not only differing Medicare supplement programs, but also different Medicare Advantage programs. So if you're looking for a contract with United Healthcare, Anthem, Meridian Care, we're their largest producers across the country. But we do have a full portfolio of products outside the Medicare arena, the MA and MedSup and PDP programs, some things such as life insurance annuity programs, final expense plans, different pre-need and short-term and long-term care products, disability income programs, and some very innovative ancillary products for you as well. That Medicare Advantage portfolio that I mentioned, and these are some options that you're going to see chasing the cost plan membership very hard, is listed here. Depending upon the state that you're in, some of these plans may be available, some of them are regional, but all the national players are part of our portfolio, and we garner a lot of respect with our carrier partners because of the way we do business and the amount of production that we lend each year. That same portfolio continues into different PDP programs, Medicare Part D plans. This is particularly important for today's presentation because many of these people, if they're on a cost plan now that has prescription coverage, you will need to investigate different PDP programs or at least help guide people to where they can actually come up with the drug coverage that they need in the future, dependent upon the coverages that they have in place now and going forward. When we look at the Medicare supplement portfolio, we are one of the largest partners across the country with a multitude of different carriers. And we're going to demonstrate in just a little bit how you can determine which carriers might be to your best advantage when it comes to offerings in different parts of the country, and based on competitive nature and a number of other factors through a quote engine that we make available to our contracted agents without cost. When you look at the standardized Medicare supplement chart, there are a number of different options, obviously, that are available for you. We have certain plan types that we think in the standardized states, obviously, for those of you in Minnesota, which is a non-standardized state, you have different types of plans that are available. But here, you can see by the comparison that there are some programs that, well, they're standardized good options to go back to, and there are some things that you have options of looking forward to that might help Medicare cost people in particular. Obviously, the plan that has traditionally been the largest seller is the Medicare Plan F. That is also sunsetting for certain individuals in the near future as well. The government decided some time ago with past legislation that they wanted folks to have at least some investment in their health coverages, so they don't want zero coverage programs moving forward generally. So that plan will be changing, but the Medicare Part D programs still play with all these different plans, and with the standardized Plan F, you do have a high deductible option that we're going to discuss in just a second. That will be a good opportunity for a lot of people. A real hot plan right now for Medicare supplements across the country, even before the Plan F sunsets or goes away for certain people, is the Plan G. And of course, the only difference between a Plan F and a Plan G is that Part B deductible coverage of $183. And the way some things work out right now anyway, some people are paying multiples of that $183 to get that coverage with a Plan F versus a Plan G. Some of the other things that we anticipate being a very strong replacement type of program for certain cost plan membership is the Plan N. And because this mirrors a lot of the Medicare Advantage type of payments where there are co-payments instead of gap payments, in a manner of speaking. This chart is one of the attachments to today's webinar, and it will be one of the pieces that is sent to individuals who have registered for this webinar as part of the follow-up. One of the things we need to make certain that you're aware of right away is the fact that there are marketing programs you can engage in now, and you don't have to wait until the first of the year. It's very important for you to make yourself visible to the Medicare population in your key market, particularly if it's affected by Medicare cost plans, because they need to know that you are there available for them as a subject matter expert in the world of Medicare. There are different regulations that come into play when you talk about marketing Medicare supplement plans versus Medicare Advantage programs. And when you market Medicare supplement plans, they are not regulated by MIPA as Medicare Advantage programs are. So you can cold call for Medicare supplements, obviously, except for one plan, and that's the 4-letter plan from United Healthcare that doesn't allow for cold calling. Don't do it, you'll lose that contract. But you can cold call for any of the other programs that are out there with other Medicare supplement plans, and keep in mind that the use of a Medicare supplement quote engine, as we'll discuss in a moment, gives you an opportunity to offer reviews now. So as you reach into that population and you run across people who have Medicare supplement plans, it gives you an opportunity to look into a switch situation now, as well as after the first of the year when cost plan membership is affected. Direct mail is also regulated a bit differently for MA versus PD, or MA versus Med Sup plans. The disclaimers on Medicare Advantage programs are generally beefier if you want to stay compliant. And so response rates on some of the Medicare supplement direct mail programs can be a little bit higher than Medicare Advantage programs, particularly at this particular time of the year. We also have different marketing programs that we use on a grassroots basis as part of a community approach. And by that, I mean there are things that you can do in group seminar presentations with different PowerPoint presentations we have available for our agents that allow you to go into different centers of influence in the community, start doing some education efforts now, start taking advantage of some of the people who are aging in or have special election periods now, and it allows you to start acting on this opportunity now instead of waiting for the first of the year. We work very closely with a number of different providers across the country, different faith-based organizations across the country, different centers of influence in different markets that enables you to get out and do group presentations if that is something that you are comfortable with. Keep in mind, as we go through this situation, if you're an agent in a cost plan state, you've been approached by a number of organizations like ours already, and you got to keep your sense of humor about it. So we wanted to lay out a little bit of take it all with a grain of salt type of mentality here, because you could be eaten as you go through and market for these programs. One of the things that we want to do as well is give you a bit of information from one of our carrier partners and the approach that they have with one of the Medicare Supplement programs, and that is through United American. So we're going to play a very short video right now to help you understand some of the opportunity from this organization.
Hello, my name is Henry Vasquez, Director of Medicare Supplements for United American Insurance Company and Globe Life Insurance Company of New York. Now, I'm excited that you're viewing this video. Premier Senior Marketing has an appointment with us, and we're an well, this is an independent. Whether you're an agent, builder, or personal producer, you can secure both contracts through Premier. The way that our commission is very unique in the industry, perhaps the best payment in the industry, and that is we're going to pay you a lifetime level commission from Medicare. Those level commissions are billable to your family and your state, main license, or even pay the very last dollar.
Folks, I apologize if you were one of the individuals that had some challenges with the playing of that particular video. The link is in the follow-up that we send to you, and it goes through and basically details some of the advantages that you have with a contract through United American, particularly for their high deductible Plan F. They have some unique marketing programs that they use in conjunction with that program, and they also have some very competitive rates for that high deductible Plan F. One of the first questions a lot of folks have with a presentation that features a high deductible Plan F program is the fact that, boy, if that premium's that low, so's the commission. Well, there are some ancillary programs that they market in conjunction with it to help address the high deductible and the commission issues that you might have. One of the things that you may not have heard as part of that video is the fact that it is a lifetime commission program. And there are some things that over the long haul that can be a very viable option for you. But as I mentioned, some of the other things that you'll want to do is, well, not everybody's a really good candidate for a high deductible F plan. What else do I do? Obviously, that's when you circle back to the standards that you have in the Medicare Supplement world, and you look at the multitude of carriers that are out there for you to access to address the needs of your prospects and your clients. So as we consider those possibilities, one of the things that we have available for our agents is access to a Medicare Supplement quoting engine through CSG that is made available without cost to agents with contracts with our organization. We're going to demonstrate that very briefly with you right now. There's a process that we'll go through to help you understand how to set this up if you don't have access to this already as a contracted agent with us, and the process that we go through to make certain that this is available to you. But as you have approval for the program, it's a very simple system to use. You just log into the program. You have an assortment of different product for you to use this quoting engine for. Keep in mind, the Medicare Advantage PDP program, that's information that helps you explain some other alternatives. You can't show that in comparison with a Medicare Supplement and act compliantly as an agent. But as you go in and you go into the Medicare Supplement world, it is a program that just requires a very short amount of information for you to use. You select where your individual lives, their age, whether or not they use tobacco, the proposed start date for that supplement program, whether that person's a boy or girl, and then the plan type. I realize that Plan F for some folks won't be an option in the near future, but we're going to use that as the initial comparison tool. I'm using this based on a sort by price. There are other options you can do with that. You can do it by the ratings from AM Best or Standard & Poor, or lay it out by company name. A lot of times when people shop Medicare Supplement programs, obviously they're doing it based off a price, so we'll leave it with that option. Ask the system to get us a quote. It'll think for a moment. Artificial intelligence can't think. And it'll lay out for you the Medicare Supplement programs that are available through our organization to give you an idea of where the different plans stack up when it comes to premiums, and give you some additional information as well. This gives you an opportunity to do a couple of things. One, it enables you to make certain that you have the carriers in your portfolio that allow you to be competitive in your own market. It also gives you an opportunity to offer a complimentary Medicare Supplement review for the people that you encounter. Your current clients, I'd recommend an annual review anyway with this program, or new prospects. It gives you a point of presentation where you can lay out different carriers and use the program to help explain different plan types and the reasoning and rationale for selecting one carrier over another. As you look at the quote engine, there is a piece over on the left that allows you to factor in market analytics. This gives you an opportunity to explain to your prospect or client what's going to happen with that Medicare Supplement plan in the near future. Over the next few years, it gives you how the rate increases based on their age. It also gives you information on how that plan has held their premium historically, what the rate increases are, and it also gives you some information as to the amount of business that's on the books. Why would that matter to you? Well, if you have an organization with a very large amount of business on the books, and that organization has an outlook that is favorable, it's pretty much going to tell you that they're traditionally going to be able to maintain their rates as well. The challenge we have with Medicare supplement programs is the fact that once a person is on that program and medical costs affect the overall premium that is available through that program, or other factors come into play as to how the carrier decides to price the program, it gives you an idea as to how stable that may well be. And we look at some of the programs and you see some of the smaller organizations are very aggressive in reaching out on price basis to bring in a book of business. And then you'll look at some of the size difference in that national book, and it gives you an idea then of how that carrier is probably going to maintain their rate structure or change it considerably. So this goes through and it gives you options on the Plan F. Look at the size of that book versus a number of other national carriers. You have different advantages as well of using this quote engine in addition to the market analytics, and that includes having an underwriting guide as part of that quote engine. There's nothing worse than just teasing someone based on price when their health conditions won't allow them to pick up the program anyway, because they got to qualify for it in many circumstances through medical underwriting. This gives you an opportunity to go in and select different health conditions and give your prospect a true quote, not a tease, something that you know they'll be able to qualify for based on your discussions with them with their health history. So it's a neat little piece that can do some different things for you that way as well. One of the things that it also does is it allows you to go in and compare those premiums with, for example, a high deductible F plan or the ever popular, growing in popularity, particularly Plan G. It's going to think a little bit before this will pop up. And this is a neat piece to give you an idea of, okay, what's that $183 coverage for the Part B deductible really cost me? Keep in mind the premium for the plan that's showing here, a New Era plan through Philadelphia American at $93.22 a month. And this is the zip code in which I live in, you know, because the world does revolve around me. $93.22. Let's go back to the Plan F and figure out, gee, what's that going to cost me for that additional $183 worth of coverage? About 26 bucks a month. 26 times 12 is a bit larger than that $183 worth of coverage. So they're paying a substantial amount for that additional little bit of security. If we go in then and we look at a program that might more carefully mirror the Medicare Advantage programs with co-payments, you'll see that the premium is lower. One of the things that is important for us to take into account is, in addition to the underwriting, we've got a couple of carriers that are a little easier on the underwriting. Cigna comes to mind right away. United Healthcare's AERP program with this, that's 2 knockout questions. You have those considerations to take into play. But something else that may reveal that, yes, at one point in time, I did work for United Healthcare, is the fact that the AERP programs allow you to change from plan to plan type with a call by the member into their customer service unit to go from a Plan N to a Plan F without additional underwriting. There aren't too many programs that allow you to do that. So something to consider where you have this tool that gives you then insight as to what carriers are most competitive price-wise and then other considerations for you. And then, of course, the tool that you can use to market to prospects and clients as well. So some things that come into play there for you that can make a very big difference to you. Obviously, if you are not part of our organization, but you still want this analysis, we can run some sample quotes for you, send them out to you to give you consideration as to, okay, these are carriers that I need in my portfolio, and let's get some contracting rolling with them. So outside of that quote engine, there are a number of other areas that would prompt you to contract with our organization. Outside of the huge options that you have with a broad portfolio of products in the Medicare arena, we do offer discounted E&O to our agents contracted with us, also discounted continuing education credits through our organization. We have also a program in place, kind of unique, that allows you to protect your income through our organization through a non-cancelable disability income insurance program for our brokers. And then, of course, when you look at all these different Medicare supplement programs, you're like, man, I want to pick about 5 of them. But filling out 5 different contracts can be a bit of a challenge, can be a bit time consuming. And hey, can you have anything that helps me prevent carpal tunnel syndrome? Well, we have an electronic contracting tool through Surance Bay that allows you to go in and set up an indication of who you are in the system, basically work up information like you would on a singular contract through an overall repository, and then you can add contracts one at a time off of it without having to fill out multiple contracts on a paper basis. It's a really neat way of being able to do a multitude of contracts with one organization very simply, and you don't have to worry about, gee, I missed an initial on this page, whatever else it happens to be. You load the system up once, create that agent profile, and roll with it. We also offer additional training programs and resources. As I mentioned before, as we went through some of the things that you can do in the marketing of Medicare Supplement plans, we have different approaches that are laid out for you through some of our different training programs that allow you a path to follow in marketing to faith-based organizations, or how do you work with providers? Do you have information on low-income subsidy and Medicare savings programs? So we have a multitude of these particular webinars that are set on a regular basis for you and recorded for you so you can access them on a 24/7 basis. Some of the other tools that are available for you as well is the electronic support that you have. In addition to that Medicare Supplement quote factor, you did notice that there are other products that are available for you to quote as well. There is also the Medicare Center program that we offer for remote Medicare Advantage enrollments for certain carriers. That is a great way for you to gather a scope electronically, store it on a secure system, and do enrollments remotely by email, basically. And then, of course, you have quote engines for other portions of our portfolio, including life insurance, final expense, other plans that we offer across the board. That Medicare Center program is a really neat way to maximize your most valuable asset, which is your time, because you can do a lot of the preliminary work up front and enable you to use that time in additional prospecting and selling activity. We do also offer a full range of incentive to our agents. The Medicare Supplement world gives us the opportunity to include that production as part of our company trip. Folks just got back from the Dominican Republic a couple of weeks ago, and many of the Medicare Advantage carriers can't offer trips like this. Medicare Supplement companies can, and you'll have a listing of those as part of the access that you have to the agent portion of our website as well. There are also some really innovative marketing support programs with our portfolio of products that you can use to get in front of people and then do a complete review to make certain that you're handling their entire needs that they're encountering in their lifetime. So in this particular circumstance, the Legacy Safeguard program through our final defense, that's a Freudian slip. Our final expense division is a incredibly effective way to pre-plan for the future. It allows you to effectively probe a prospect or client to make certain that you are taking care of as many needs as possible, including the need for the inevitable. We do also offer a special program that is a way to put accessing the public through social media on autopilot, and that is the Coverage Made Easy program. That's something we'd want to get you additional information on that allows you to work the wonderful world of the World Wide Web without putting in a lot of effort in order to do it. Some of the other things that we offer is a full menu of lead programs to help get you in front of folks. We do offer customized calling lists that are ordered specifically for you with a minimum of contracts with our organization. Our team can actually supply you call lists butted up against Do Not Call at no cost to you with a minimum of 3 contracts with our organization. We do also offer, as I mentioned before, different marketing programs that are community-based that include retail marketing. Yes, some folks like to work Walmart, believe it or not. The folks that have operated in that successfully in the past, well, that selection process begins the 1st of May, believe it or not. So we'll have some additional information available to you as well. We do have a program that's set up that helps you market through faith-based organizations. It's a great way to pull people into a group presentation setting in a trusted environment. We have scripts and everything that allow you to understand how to approach those opportunities and how to follow through with them as well. Because of the size of our organization and the unique relationships we have with different provider organizations, there are also opportunities to access those deliverers of care as part of your marketing program. And we offer training on how to go about that as well in order to make it as effective as possible. There are, of course, also different carrier-generated prospect programs that certain companies make available to contracted agents. We can give you some information about different internet lead sources. And then, of course, we have a direct mail support program through our organization that's production-based as well. And that's a fairly simple program where when you work with our organization, you write 10 apps in a month, you'll pay $230 for a 1,000-piece mailer. That, my friends, is a bargain. If you write just 5 apps in a month, you're going to pay the deeply discounted rate of $305 through our preferred lead vendors. We do that in order to make certain that the letters that are going out are compliant to protect both you and us. You have a ton of reasons why people need to talk to you. There's a ton of legislation out there. Media coverage confuses a lot of people. And you go back to some of the things that are specifically affecting us in the Medicare world, such as the Medicare Improvement for Patients and Providers Act. When you deal with the Medicare population, this creates confusion as well. Being knowledgeable about the regulations helps differentiate you from your competition and does allow you to have a marketing edge. We have that information available to you so you can address the questions that are brought up by different factors in our environment for your prospects and clients, because we believe that you, as a qualified insurance agent, are the best source of the answers for your prospects and clients. What we're looking to do is make certain that we are a source of knowledge and product for you, and we want an opportunity to work for you, as we want your business and we want to support it and earn it. To become involved in any of these programs that we offered information on today, or for additional information, you have to determine what is a valuable addition to your personal marketing plan. How are you going to map out your success, and how are you going to determine what you need to do to move forward and be successful in what you choose to do? First off, you got to make that decision. There's the old expression, when all is said and done, more is said than done. You make your decision. We help give you information to help you make that decision. You agree to move forward. You contract, you certify, you study, you do what you need to in order to be prepared to best serve the needs of your prospects and clients. And then you find additional prospects. And we can help you do that through some of the programs that I've just detailed for it. One of the things that is very important is to find those round to it's, those little coins that say, hey, I don't need to just wait until I get around to it. I need to do it now. Marketing to this population that are affected by cost plan changes now gives you a foot up on your competition in your market as well. So become very aware of that opportunity, access some of the information that we're supplying you as part of this presentation, including the presentation itself and the different pieces that detail the legislation that brought about these changes for your folks, information about the Medicare Supplement programs, an opportunity to investigate the different carriers, because keep in mind, some of these carriers are very adept at delivering systems that help you operate more efficiently. E-apps, telephonic apps, marketing support programs from the carriers themselves. There are a number of programs that are really, really helpful for you. The Authorized to Offer program from AARP, the Mutual of Omaha programs, Americo. There are a ton of plans out there, WULA, that have different marketing support programs that can make you successful by choosing the correct carrier as well. So that's something that a conversation with one of our marketers can help you determine, hey, what do I need to be successful in my market? How can I access this population that is forced to make a change? And how do I do it effectively, efficiently, and most importantly, in a fashion that serves their needs and yours as an agent as well. That said, these are 3-year contacts here in Texas or across the country. You can reach a marketer in your market by dialing through 1-800-365-8208 and asking for a connection to a marketer. My name is John Dubas. We have Justine Sawyers and Carrie Burnell on our office. We have a huge number of other marketers across the country that can help you anywhere that you operate, and we want to be that resource for you. That said, I want to thank you for coming on the line with us. I'm going to urge you to access the information we send you. We're going to be sending some follow-up with the attachments, but keep in mind when we add some of these attachments, sometimes that will put that follow-up email into your spam filter. So be prepared for follow-up communication from our organization, and we'll make certain that we also touch on any questions that we may have missed through the course of today's presentation. One of them that I did not address is if the client has a Plan F, will that plan possibly be non-renewed? I appreciate that question a great deal. It is a program that generally, depending upon the carrier that is issuing that Medicare Supplement plan, most of them are going to continue those programs into the future because folks that have those plans are grandfathered. They're not going to go away generally. There may be marketing decisions made by certain carriers that make me a liar in that regard. But that is a situation that if they non-renew that plan, generally they have some guaranteed options to get some coverage elsewhere as well. So keep in mind that you'll always have an opportunity to take care of your people. Generally, however, I don't see mass non-renewal of Plan Fs in the future. What we might see is a change in the premium for those programs, because as that block of business closes and that segment of that carrier's book of business ages, you might see some differing things that come about on the premiums that those individuals are charged. They might not be non-renewed, but they might have some differing options when it comes to how they pay for it. So that said, I want to thank you for coming on the line with us today. Watch for some of our follow-up conversation that we'll have with you electronically and telephonically in the very near future. Keep in mind you can reach us through our website at premiersmi.com or through 1-800-365-8208. We invite you to reach out to us, where we will follow up with you as well, and we look forward to those conversations in the very near future. That said, I wish you a good rest of your day, a great weekend, and happy selling. Thanks so much.